My name is Heather Hunt. I just wanted to introduce myself. I'm a chiropractor and cranial sacral therapist, and I practice functional medicine here in our little town of Nevada City in California. And today I have Janell with me, and I'm hoping you can introduce yourself.
I'm Dr. Janell Jones. I'm the pharmacist and owner of Gold Country Compounding in Auburn. We specialize in medications that are made small batch by hand for one specific patient in mind.
And all women owned. You own it?
Yeah.
And all women operated when I was there last time?
Yeah.
Except your son running around?
My 2-year-old comes to work with me still. It's kind of amazing.
So we're going to start the conversation around low dose naltrexone, which I'm been hearing about for years, but really don't understand. And I know that's a passion of yours.
It really is. It's a very underground patient-driven movement because it's not a commercially available drug. It's not patented by someone, and it's not specifically FDA approved. So there's not a lot of funding to really push the information on it. So it's patients, doctors, and pharmacists working together to get information out on the medication.
And I've been talking to people about it. When I mention it in practice, they say, "Oh, is it naltrexone?" So can you differentiate?
Yeah. So naltrexone, the actual commercially available product, was FDA approved in the 80s, specifically for opioid abuse and alcohol abuse. And about the same time that it was FDA approved, some other doctors realized that if we used it in a slightly different way at a low dose, that's the low dose naltrexone part of it, it gave a very different effect. And that's kind of where the magic comes in with this medication.
So can you explain what it is?
Yeah, how it works.
Yeah, how it works.
Yeah, so we're actually taking the same mechanism of that full 50 milligram dose in the regular FDA approved naltrexone. It's an opiate blocker. So it works on the same cells and receptors in the body that an opiate would. But even more importantly, those opioid receptors in our body are what our own natural endorphins work on. They're natural feel-good, pain-relieving, like hormones, proteins, things like that, that just relieve pain on a normal level. So it seems kind of counterintuitive, but with naltrexone, you're basically taking something to block that opioid receptor, the endorphin receptor that would normally relieve pain. We're doing kind of something a little tricky.
Okay.
We're going to do it at a super, super low dose so that it only turns off some of the receptors. But for the 4 hours that the naltrexone's in your body blocking those endorphin receptors, your brain notices, this room has gotten a little bit dimmer. There's not enough lights on. Those lights are your endorphin receptors being triggered. So what it does for the entire rest of the day is the brain gets busy creating new receptors and more light switches.
Yeah.
Basically,
okay,
to brighten that room back up. So you're tricking your body into making more of its own natural endorphins, which relieve pain normally. So,
right.
Really cool.
Very cool. Yeah. So how does it work? Because I've also been told that it's for anti-inflammatory purposes. How does it work with inflammation?
It's actually really cool. So besides working specifically on endorphin receptors, it also worked on receptors in the immune system. So you can kind of think of autoimmune conditions as a really barky, angry dog. It's triggered to bark even when there isn't anything for it to bark about.
Right.
You know, like if somebody knocking on your door, you want it to bark to let them know there, but they bark at everything.
Right.
What the naltrexone does is works on those receptors, tells them to turn off while it's there, settle things back down so that the immune system isn't overreacting to the inappropriate stimulus, which means that you're releasing fewer and fewer inflammatory chemicals that cause the inflammation and the pain. So gets it back down to a healthy baseline.
And that's would be the same. So that anti-inflammatory is very tied into the autoimmune
effects. Yeah.
And just general immune system or mostly autoimmune?
Typically, what we see is we're using it to correct overactive immune system, which would be autoimmune conditions.
Okay.
But yes, it can actually also help bolster the immune system too, because it's helping it perform properly.
Right.
So it's not being suppressed or overstimulated.
Right. Right. And then, do people use this for mood alone, or are they looking at bigger pictures?
So mood is another thing to bring up that's absolutely amazing. So if we go back to our brain, besides increasing endorphin production, it's also going to stimulate dopamine release and dopamine upregulation. And dopamine is then also downstream converted into other neurotransmitters that can really help with mood.
Okay, so let's talk about dopamine real quick, because probably a lot of people aren't totally familiar with that. Can you tell us about dopamine?
Dopamine, yeah. So it's one of our main neurotransmitters in our brain, and it's our happy chemical. So when we see someone we love or we do something we really enjoy, that uplifting, excited, warm, loving feeling is usually being triggered by a dopamine release.
Okay, so because I'd never heard about low dose naltrexone or LDN with just mood, but that's just do people use it alone for that, or is that just sort of an added bonus?
It is an added bonus, but yes, some people do take it specifically for mood. The VA, veterans doctors are doing research on it for use with PTSD. And it's actually really helping with a lot of different types of depression and anxiety.
So usually how much do people take? What's the dosing?
Yeah, so I would say 80 to 90% of patients take a 4.5 milligram dose, which is significantly, less than a tenth of the commercially available 50 milligram tablet.
Right.
Some people take even less, and then sometimes that can go up, but traditionally it's just a 4.5 milligram capsule.
So if that's sort of temporarily dampening your own opioid production for that 4 hours, when is the best time to take it?
Because it is such a low dose and it's only dampening your own endorphin reception for a short period of time, it's such a small amount that traditionally someone can't even notice.
Okay.
It's enough for your brain, the organ, to notice, but not enough for you to feel a difference.
Got it.
So it can be taken at any time of day.
Okay.
Although I do typically recommend bedtime. It helps most people sleep better. So
that's
take
never a bad thing. Yeah, that's great.
Yeah.
Okay. And then ordering through your pharmacy, what's the cost of this?
Sure. So the most common thing that we do is the 4.5 milligram capsule again, and a 3-month supply is $85.
Yeah, that's such a great. And I love when I called, you said, what do you want it in? What base? So that seems really specialized, and that's something you can do because you're a compounding pharmacy.
So yeah, and that's one of the differences too, because if you went into your regular old Walgreens, Rite Aid, corner drugstore, the only thing they have there is that 50 milligram tablet.
Got it.
So low dose naltrexone is typically filled at a compounding pharmacy because we actually make everything by hand. So if you need that 4.5 milligram capsule, we're going to make it just for you. Think old school, like mortar and pestle, like literally, triturating the powders together, filling the capsules. It's all your dose.
Okay.
Which is fun because the low dose naltrexone only takes up a little bit of room in the capsule, and we need to fill the rest with something else. It's part of the process for making the capsule. So instead of wasting space with cornstarch or stuff like a lot of commercially manufactured products, we have options for each patient on what else they want in their capsule, whether it's ginger or acidophilus or vitamin C, magnesium, those kinds of things.
Yeah.
Use the room.
Yeah. And
give it a health benefit.
And I remember you telling me you liked the acidophilus.
I do.
Is that
you can never get enough probiotics?
Yeah.
And a lot of health starts in the gut, so that's a little bonus.
Great. And then for people who, because this is a prescription drug, right? So people can't just call and say, I want this. You have to go through.
You do have to have
a care provider
for it. That can be the biggest challenge with low dose naltrexone, because a lot of doctors still don't know about it.
Right.
I love talking to doctors, sitting
Yeah.
down and explaining how it works, what it does, and what different diagnoses it can be used for.
Right.
But yeah, definitely have to find a receptive doctor that's willing to learn new things.
Right, right. So if you were sitting down to talk to a doctor,
Mhm.
can you use some doctor speak for us a little bit and just give a few bullet,
Yeah. So pretty much in my opinion, all of medicine is risk versus reward. There is a lot of great potential for naltrexone to be extremely helpful. It's starting to become first line therapy for some conditions. I've seen just absolutely staggeringly amazing results. And then you have to look at the flip side. Well, what risks does it have? What drug interactions does it have? What long-term health considerations? And it's kind of unbelievable how safe this medication is.
Yeah.
It can be taken at 50 to 300 milligrams daily with no long-term negative health effects, no organ damage, none of the other problems that we see, withdrawal effects or things like that, which is crazy.
Yeah.
It has very few drug interactions. The only thing that it can't be taken with are opiates like Norco, morphine, oxycodone, because they directly block each other. So
Right.
neither one would work as well
Got it.
as they would if they were alone. There's very few side effects too, which is crazy. You look at most medications and the list is a mile long. And with this one, there's pretty much 3 side effects that we see in less than 15% of patients. It can cause insomnia or vivid dreams the first couple of nights that's taken. That typically goes away pretty quick. And if not, we'll just switch and take it in the morning.
Yeah.
It can also cause headache. That's only about 8% of patients. Once ago, it typically goes away in just 2 or 3 days if it happens at all.
Okay.
And then the last is for some patients that can cause nausea, or at least I've heard that. I've never had a patient with nausea.
Nausea.
Yeah.
Okay.
Yeah.
Very good. And what conditions do you like using it for the best? Do you recommend?
Do you have a couple of hours?
I know.
The one I think that I'm repeatedly have patients calling me back and saying that it's been life changing is fibromyalgia. Pain levels go down, energy levels go up, their mood is better.
Yeah.
It's amazing.
Yeah.
It's also very helpful for chronic fatigue.
Okay.
I have a lot of patients with Hashimoto's thyroiditis.
Yeah.
It's one of my favorite ones because we look at blood levels for antibodies with Hashimoto's, and when they start the low dose naltrexone, you actually have lab work showing the antibody levels going down as they're taking the medication.
Right.
Which is just
amazing.
Right? They get
Yeah.
their thyroid normalized, their thyroid dose normalized, and really get some control back.
Right.
My goodness, it's used for fertility, MS, Parkinson's, arthritis, migraines, definitely. It can be, especially because it's working in the brain, getting those endorphin levels and everything regulated, really helps with pain relief that way.
Okay.
IBS, IBD, Crohn's, all of those intestinal issues.
So why aren't doctors prescribing this?
It really comes back to not knowing about it.
And also maybe because it's not pharmaceutical, huh?
Yeah. So the naltrexone itself that we work with raw powder, that ingredient is FDA approved.
Right.
But the doses that we're compounding are not specifically FDA approved.
Right.
So, and because there's not a large drug company pushing the marketing and paying for the education on it,
right,
it just doesn't get the recognition that mainstream medications do.
Okay.
Yeah.
I'm wondering if you want to share anything about your personal story.
I do have a personal story that's pretty amazing. We mentioned that my 2-year-old son comes to work with me every day. I had spent 7 years trying to conceive. Went through many different medications, different diagnoses, different approaches. And literally nothing was working, and we were looking into IVF or adoption. And I had a patient come to me and ask if low dose naltrexone could help with fibroids. And I'm like, I really don't know. So I started looking, and I found a doctor that had started using low dose naltrexone for infertility caused by polycystic ovarian syndrome, which is what I have. And the results were just amazing. So I'm like, oh,
Why
I
not?
know it's safe. I make the medication. I'm like, why not try? And literally within 4 months, I was pregnant.
Oh my gosh,
After everything possible for 7 years.
that gives me goosebumps.
It was amazing. Just
So-
amazing.
Okay, so then were you using that standard 4.5 milligrams?
Mhm. I started straight off at the 4.5.
Mhm.
Some patients like to start a little bit lower with concerns that changing their hormone levels or their endorphin levels might affect them in some way.
Right.
So we started a lower dose to be even safer.
Yep.
I didn't have anything to worry about, so I just started straight off at the 4.5. I think the first thing I noticed though was about 3 weeks later, somebody cut me off in traffic. I was like,
Yeah,
it didn't bug me.
right.
I just felt more centered and calm.
Yeah.
And overall happy.
That,
So it was amazing.
so I started it at the beginning of August, so I guess that's what, like 6 weeks now. For perimenopausal migraines that I haven't been able to totally nip, and it's working really well. And I didn't even know the mood benefits of it. I mean, it makes sense from my brief chats with you earlier, but I am really noticing that too, and it's really nice.
Yeah.
I feel like it's just helping me. It's just
Yeah.
there's just this little helper.
Yeah, that's one in like consultation with patients that starts the first time. And I'm like, that's one of the big things. It takes time. It's
Yeah.
not like you pop an aspirin and your headache goes away. It's the naltrexone helping your body get back to a healthy baseline, and healing takes time.
It takes time.
It
So
takes a
so then
lot.
that's just what's the game plan? Like, how long do you stay on it? Can you stay on it forever? Tell me about that.
It kind of comes down to why the patient's taking it in the first place.
Okay.
If the diagnosis is something that can be cured and go away,
Mm-hmm.
then they can take it for a period of time, get back to normal healthy, and stop taking it.
Right.
If it's something that is always going to be part of that patient's medical history or just part of what they have to work through, it can be helpful to just stay on it lifelong.
Yeah.
I'm never gonna stop taking it.
Yeah.
I love the way that I feel.
Right. Right.
Yeah.
So then another reason I had decided to go on it was because I had heard repeatedly from patients who are, had cancer or have cancer now, and they're trying to do alternative things to help complement mainstream treatments. And low dose naltrexone seemed like it was part of most of those protocols.
It definitely can be. And it's even a good adjunct to traditional chemotherapy and
Yeah.
radiation.
Yeah.
Yeah, and it really goes back to the immune system functioning more normally. The low dose naltrexone can work on certain groups of cells that help, reduce cell proliferation. So
Yeah.
and
that seems like as a chiropractor, I'm always thinking prevention and what can we do to stay vital in our cells and in our bodies to hopefully increase our health span and lifespan. But it seems like a perfect tool
for a lot of
just something to add in.
Yeah.
Because I don't want to develop any of those things, preferably.
Right. Yeah.
And then the other thing you had told me when I first came down and to your pharmacy was about the Hashimoto's and how you had to start low dose with that. Can you explain that? Because I thought that's awesome.
So that was what I was talking about a little bit before, where you can see the lab work with the antibody levels. Those antibodies attack the thyroid, and then the thyroid doesn't work as well as it should, and it stops producing enough thyroid hormone, causing hypothyroidism.
Yeah.
The thing is naltrexone almost works too well. If you start out with that 4.5 milligram dose, it can suppress the antibody levels so fast that the patient can actually wind up becoming hyperthyroid.
Incredible, right?
And then they're doing this like pogo effect where they've gone way too low from the Hashimoto's, and now we've suppressed that and their levels way too high because their thyroid's like, I can finally do my job, and it goes.
Right.
So we
Right.
started a super low dose and work really slowly to get the antibiotic levels to come down slowly
Slowly.
and at a manageable level so we can keep track of the thyroid's health.
Right, right.
Yeah.
That's so
Yeah,
exciting.
yeah, right?
Yeah, so exciting. So we have a practitioner here that can prescribe that. I can't prescribe as a chiropractor.
Mhm.
If people call your clinic, is that, or your pharmacy, is that, do you have providers you can direct them to?
Yes.
Okay, great.
several.
Oh, wonderful.
Most of the doctors that I've worked with that have started patients on it are now sending everyone over to just so I can sit down
Right.
and go over medications with them.
Great.
And if I think low dose naltrexone could help them, and it's 9% of the time I say yes.
Yeah, yeah,
It's pretty amazing.
great, great.
Yeah.
Well, thank you so much for,
Welcome. I love talking about it. So
Yeah.
if any of your
So
patients
Gold-
want to call me at Gold Country Compounding,
yep.
I'd be happy to answer questions.
Okay, you are so generous with your time. I've already called numerous times and emailed, and I feel like as a busy business owner and mother, I'm sure you have multiple other roles I don't even know about. That's just very sweet and wonderful, and it's something I strive for also.
Yeah, it really is my pleasure.
Yeah,
It's amazing. There's nothing better than me than when I have a patient. Just a couple of weeks ago, I had a patient with Parkinson's start taking it, and he called me back after 3 weeks and telling me he hadn't thought this clearly in 10 years.
oh,
Nothing better than that.
absolutely. Yeah, I love that. Well, thank you.